I am going to hop over to the video real quick just so I can see where Madison is. Can you roll your right there? Okay, and let's make sure light enough. Yes. Okay, so that's a good video. Okay, so the first one we're going to look at is the rectus femoris. And the rectus femoris is pretty easy because all you got to do is find the top of the kneecap and then just follow that muscle all the way up. And it actually goes up and just inferior to the ASIS. Okay, so you would palpate that muscle. That's the rectus femoris. Okay, the sartorius, ASIS, it comes all the way down here and attaches to that pes anserine groove. So remember we palpated the tib, tuberosity, came just medial to that. You found the other lump there, which is a tubercle, and that's where the pes anserine inserts, the sartorius, and the storis is the longest muscle. Okay, vastus intermedius. Okay, so underneath the rectus, you actually have to go in to find it, but it's the same idea. This one though, these ones are not two joint muscles, and they just attach right up here on the femur. Okay, vastus lateralis. Turn sideways to about right. Turn your knee this way just a little bit. Okay, so you're looking in this area for the vastus lateralis. Same thing, it comes in and attaches right there. Okay, most important for us in terms of athletic training is the VMO. And if she makes a muscle, okay, you can kind of pick the VMO right here. But this is the vastus medialis, and it goes up. But the most important thing, again, remember with the vastus medialis, okay, and as you can see on the actual slide there too, its insertion is this medial border of the patella. So weakness of this causes the patella to go over laterally. And so when we're doing taping or anything of that, the patella, it's important for us to identify this as a weak muscle if it is, because then we have to target that in rehab. Okay, the hamstring group, she just turns around. The hamstring group is really easy to pick out. Ischial tuberosity, which is the bone in the butt that you sit on, and then they come here. The biceps femoris comes and attaches right to the fib head. Okay. And then the other two come over here. Now the membranosus comes and attaches to the posterior aspect, and then the tendinosus also comes around and attaches to that pes anserine. Okay, gluteus maximus, right up in this area, you can see the big chunk. Okay, the idea is, the understanding is the gluteus maximus, as you can see, it comes over and attaches to the femur there. Okay, another important thing that we're going to talk about as it relates to that. So, if you find your ASIS here, and then you have your crest, and then you have a nice fossa here, or a big shallow, this is where your gluteus medius and gluteus minimus are going to be located. So right in this area. And the thing is, remember, find that head of the femur. Okay, her head of the femur is right here. Okay, that group muscle comes down and attaches right here, because those are the ones that are responsible for abduction. Okay, gluteus minimus is just right underneath that. Same idea. You guys are going to have to point to these. Greater trochanter, again, all you got to do is come up to the iliac crest here, come down, walk down, okay, and you're going to feel the big lump. The easiest thing to do is have them shift their weight, kick their butt out right here, and it'll stick out right there. Okay, if it goes back in that way, you can see it disappears, but if she really shifts her weight, the trochanter will poke right out for you. And that's the identifier. That's the okay. Tensor fascia lata. Okay, so if you go right off ASIS and fall right down, there's a big little muscle group here. Okay, that's that tensor fascia lata, and that tensor fascia lata then turns into the IT band, and the IT band comes in and attaches to Gerdy's tubercle. Okay, and the Gerdy's tubercle obviously is right there. And this, again, when we're looking at snapping knee syndrome or snapping hip syndrome, okay, tensor fascia lata, but more important, the IT band could be one of those culprits. The IT band can snap over the femoral head or trochanter, and then, okay, the adductor group. Okay, this is a little bit close and personal, but I'm not going to go into that too much. But the idea behind the adductor group is understanding that the pelvis and then the pubic bone, and the pubic bone rim is where all the adductors attach. So if you look there, the adductor brevis, okay, is a smaller one, but there's actually one above it. It's the pectineus, and that is a strong adductor as well. And then as we go down, you have your adductor longus, and then you can see your adductor magnus. Okay, your adductor magnus comes all the way down, catches here, and then if the next one is true, the gracilis. Okay, the gracilis is another adductor, and that's the last muscle of that pes-anserinine group. Okay, so you have your sartorius muscle that comes around to pes-anserinine, you have gracilis that comes to pes-anserinine, and then you have your semitendinosus. Okay. Another way to look at the adductor group is you can look at the adductor group, and you do kind of a almost like holding a I call it trigger, but they'd have all their fingers, but I like to do a trigger grip. And your trigger grip basically is you're coming across, and then your fingers are actually identifying those adductors. This is going to be the reason why. Okay, the other thing is that I wanted to show you with this video, or not video, but this PowerPoint, is the IT band. And so you can see this tensor fascia is right here, tensor fascia, and then you can see it extends down to the IT band, and you can see the IT band wraps into Gerdy's tubercle, but that condyle is right in this area. And so depending on the tightness, or think about if someone is bow-legged, okay, sartorius, torus, okay, gluteus maximus. These are just different ones. We're not going to talk about the piriformis, the quadratus femoris, the sciatic nerve, or the arbitrator's internal, external, or the gemellus. We'll talk about that in a different one. We'll talk about the actual pelvis in a different one. Okay, but most important, what I want you guys to see in this, that causes that movement in. So when we're actually wrapping, we want to make sure we're wrapping, pulling up, and then in. So this would assist with flexion and then adduction. But I want you guys to tie it. I want you guys to think about it.
So I have done all the palpitations for the muscles of the knee. That went along with your voice. Now I gotta do the gracilis insertion, which, if I'm looking at it, I'm gonna put my phone down real quick and try to do this. If you can see. So if we go back to gracilis, so I have got my belt, say, do this, and I'm supposed to be tie at the pectineus and show the action. So got the gracilis. The pectineus. Don't mind the dog. I'm trying to do it off the videos right now. So the pectineus, it's a little higher up, but if I can't pull it that way, so pulling on that leg where it goes out. I'm not exactly sure how to do the gluteus medius. but you got the hamstring, which if we do it right here, hamstring, going right on it. And that should be the muscles of the knee video.